G'day everyone, this is Stu from Plan Manager System, and today I've got Ivania from Care2U Community Services. Ivania, how are you going?
I am really good. Thanks for having me.
Absolute pleasure. So I wanted to talk to you today about the work that you do, particularly around the relationships that you build, and in particular, I really want to talk about the level of trust that goes in. And before we even sort of really deep dive, it's that I wanted to talk about this because there are so many providers that are out in the space that do provide similar services, but will constantly be shouting, I'm looking for participants, or we have capacity, and then wonder why they're not necessarily gaining a bit of traction. And I think that comes down to the relationships that they build. And as someone who is really an expert in great relationship building, I wanted to actually let you have a chance to tell us more about why do you think trust is so important in that relationship building process?
Well, thanks for having me. I wouldn't say myself is an expert, but
and humility as well.
I worked in the health and disability industry for over a decade. I've worked in multiple roles. Started as support worker, and then support coordinator, and I also was a social worker. And now I'm a business development manager. And what I focus on is building relationships with participants and the stakeholders. Trust is so important in any relationship because it is the foundation of working together towards the same goal. So any person, no matter it is your participants, stakeholders, or any business development representative of another company, we have to understand the person before we understand the service. So I'll say I'll show interest in understanding the person, get to know them, and then we'll understand what motivates them to do the services.
Yes, and exactly right. And that is that foundational trust that is so important. But then how do we build that trust? How do we get that started?
So first, I'll introduce myself. I usually introduce our company. Our company has been around for more than 5 years. We have 6 group homes and 10 apartments, and we basically based on the North Shore, but we have 10 apartments in Marrickville. And we also have a registered nurse in the team, and we also have minimum standard for support workers. They need to have a minimum certificate of 3 in disability or community services or related field, or they either be a nursing student or OT student, and so that we can ensure they have some basic knowledge, and we'll also provide training before they are onboarded to look after participants. And yeah, so then I introduce myself. This is the company I work for, and we focus on building participants to be connected with the right support and that truly meet the needs of the participant. So in terms of like location, if they're familiar with that area, they know what's around, like they know the community, they know the shops and parks and places they can spend time. And that's really good to have the like familiar environment when it comes to adapting to a new environment, like a 24/7 supported living home. And as that's what we do, the more comfortable they feel and the more I listen to their needs, that's when the trust is built.
Yeah, and it's not something that's going to happen instantly. That is something that does take that time and attention and effort. That's not something that you just get out of a single Facebook message.
No. So it is like an ongoing process of building trust. But first, we'll have to understand each other, and then we'll kind of, when it comes to a point that's a crisis coming up. When I was a support coordinator, there used to be a lot of different crises when participant become homeless, or when participant has like medical incident event happen, hospitalized, and that's super important when they have an issue that I'm there to listen and I'm there to help them to get through the obstacles and to meet their needs and do whatever to get it through together. And over time, this relationship will build, it will be enhanced and get better, and it get deeper. And when the bond gets better, that's when participants will kind of listen and collaborate with us. So when the bond is deepened, that's when the participants and the providers or whoever we're working with, that we know we have each other's back and we know we're there to support each other. And good things happen because when the bond is there, we're able to kind of navigate things together. And even is a difficult conversation, then each other will become like much more understanding.
Yeah.
And we're having the empathy, and we know that who we're working with.
Absolutely. So, Ivania, I know it's great that we're talking about these foundational building blocks and the establishment of trust and a trusting relationship, but can you give me an example of one? And obviously, please, for the sake of the reference, just change the person's name. Do you have an example of a time where you've had to build trust with either a participant or another stakeholder that's resulted in something positive?
Yeah, of course, all the time actually.
Just give me one, because otherwise we'll be here all day.
Yeah, from my career, I've worked with hundreds of clients in different roles. So there will be some clients that with a bit of trauma background. So one of my clients, I changed the name to Matt. He grew up under the care of minister, and he has a few like foster home, foster family relationship broken down throughout the years. So he knows that trust is like super important. Whenever he trusts someone, he wants the other person to be around. And background, his history means that we're going to have to work extra hard to reassure him that we are here to support him, and we have consistent communication. So when things, issues brought up, for example, we have clients moving into our seal accommodation in Marrickville, and he wanted to visit his dad he hasn't seen for many years, and it was like a really big thing for him because he has not seen his family for a long time for some reasons, because he's under public guardian.
Yeah.
And so he wanted to go over for a week during Christmas time, and I know that he's going to go. Even we haven't actually got approval prior, and it's very tricky. And now we informed the public guardian, and we said this is what Matt liked to do to spend Christmas with his father, and he proposed to do 7 days. We suggest to do a bit shorter. However, he insisted, so we respect his choice, of course. And so we informed the public guardian, and we said we're here whenever you want to come home. So he went for a night, and he called us the next day. He said he wanted to come home. So he came home just before Christmas, but he did try, and he actually spent Christmas at home with our support workers. Yeah, so it is something unusual because we usually need approval for from the public guardian if this happens. However, we kind of respected him as he was ready to go the next morning. He notified us by email at 9 p.m. and then he was ready, packed the next morning, 9 a.m. So we know we got to ensure his safety, and he wasn't like willing to share his dad's contact address at the start. But I said to him, this is what we need, the minimum, to let the public guardian know so we can ensure your safety. And we also keep checking in with him. So we had like agreed schedule of checked in. So it's like every 90 minutes. So it's like 9 o'clock, 10:30, 12, and then 5, 6:30, 8. And he promised that he's going to respond to our messages and our calls. If he needs anything, he'll let us know and we can come and pick him up.
Okay.
So that story was like a kind of like a test, because I know that if he brought it up early on, maybe there will be a lot of discussion about his leave. And it was like the second week or third week that he moved in. And so it was like kind of a story that he wants to be independent. He wants to like have his own choice and control, which we respect. And at the same time, we want to ensure he's safe. And he knows that he needs to let us know if there's anything happen so we can support him.
Yeah, and I think that's really nice about that story as well, Ivania, is that it shows that it was the provider giving a level of trust to a participant to do what they say they're going to do, but at the same time, it's also you mirroring that trust back, so that when that participant, so Matt, was I need to change his name to, so when Matt ever needs support, he knows that he can count on you guys to be able to respect his choices and to understand that he's in control of his situation. So no, thank you for sharing me that little story. That's nice.
So a lot of the times participants feeling a loss of control when they move into a supported independent living home. So we're trying to give them as much control as they want, like what they like to eat for lunch and dinner, so they can do their grocery shoppings, and they feel like they need to be supervised in the community. So like, let's say if a participant wants to go out alone, then it usually needs an OT approval, like a functional assessment before they can go. And in this case, like if they need to go on like a longer leave, they usually need like a bit of discussion with the allied health team and public guardian. And so it is about how to navigate the situation if anything arises that's not really a usual practice.
Yeah.
But we did as much as we can, and we know the contact address, we know the phone number, and we know the participant's got a phone that he responds to every 90 minutes.
Yeah.
So then we can ensure that he's okay. Yeah.
Okay.
And he got to spend a day, a night with his dad.
I was going to say he got to
Yeah.
spend some time with family,
Yeah.
although it wasn't as long as he had originally envisioned.
Yeah.
That's still good that he was able to then trust in you to come and get him as well.
Yeah, and it's a huge move because he hasn't met his dad for years.
Yeah, absolutely.
And so that's cool.
Oh, that's real nice. Yeah. Okay. And so then, I mean, that's trust between a provider and a participant and whatnot. And I want to sort of dive, because I know you've got so many years of experience in terms of different roles and different parts of the NDIS. And I guess what I would like to try and find out from there is that for myself, for yourself, for participants, as well as for other providers, what is it that makes a trustworthy provider? What is it that you're looking for to be able to trust a provider, whether it be, from your previous roles or even in your current role, where it doesn't, and again, context is, I'm open to how you want to look at the context there, but how do you find a good provider that you can trust?
Yeah, so with good providers, we need to ensure they have consistent communication. So when you approach a new provider, you can ask, like, what's the process of referral once the referral form has been filled out. Some bigger organization might have like an intake officer, and then it might be transferred to the care team or care manager. And some companies will have a registered nurse who look after the participant. Especially with Care2U, we have a registered nurse that's look after the participant's health and medications, and it is super important. And because when we have that knowledge, then sometimes participants will have certain ache and pains, or they have certain behaviors of concern that could be health related. So, and then from there, how the information are retained. Do they have like a good case note system, CRM, to record all these information? So when it gets passed on to the support worker, the informations are there. So, and also the location could be important. Having a provider that's nearby that ensure they don't charge excessively for travel. I know funding is limited, and we want them to be able to respond as quickly as possible. If the provider is near where you live, then they're more likely to provide a support worker like in time, or like at a very short notice. Or for example, you have an ad hoc service that you like to use a support worker, then it might be come in handy. And then so we talk about the location, the CRM, and the team, whether they've got a registered nurse, and what's the minimum requirement of a support worker. So that's what we need to inquire. Some participants will need at least some training for like behavior support, or they need manual handling training, or if they have a health-related disability support that needs specific training, if they have like a CPAP machine and all sort of other like insulin injections and stuff like that. And we need to ensure that support workers have the right qualification and experience to support the participant. And then the last one is that what's the reputation of the company within the industry. So usually we can go on Google and look at the Google reviews, or we can ask someone we trust in the industry, is this a good provider? And have you heard any good things about them? And that will actually count, because a lot of the Google reviews online, it could be not the full picture. It's so important that we know that someone in the industry have heard good things about them, and so then you can actually be confident that you're making the referrals to the right person. And a lot of the time, if it's a small provider, they usually, like the company director or the operations manager, might be a lot hands-on, and they're quite hands-on. That means that the information is going to be retained a lot better to compare with a bigger organization where sometimes the information got recorded and got lost somewhere down the track. And yeah, so that's my advice for choosing a good provider.
Yeah, absolutely. And one of the things I want to add is that I noticed that we talked about those sort of Google reviews as well, is that the same thing goes with hospitality and restaurants, is that if you have a great experience with a restaurant, or in this case, a provider, you may not necessarily leave a 5-star Google review, but I can guarantee you that if you have a negative experience with one, you are absolutely going to leave a 1-star review. And so when that happens, Google reviews can unfortunately become skewed with bots that are being paid to put in 5-star reviews, counted out with very angry people with 1-star reviews, that you don't get that full picture. And that's where, and Ivania, you pointed it out really well, is that trust within someone within your own network, trust within the word of mouth of people that have experienced something with this provider that you can respect and trust, makes such a difference in how you can perceive them before you actually get a better picture of the real organization and not just what you want to see on Google.
Yeah, exactly. Thanks for sharing.
No, thank you, because it was a really good point that you'd sort of mentioned in there. And before we let you go, though, Ivania, is that tell us quickly in a nutshell, because you have talked a fair bit about what Care2U do, but are there any other services that Care2U provide that we may not have heard about yet?
So we have a registered nurse that I've talked about. So our registered nurse currently looking after 6 group homes and 10 apartments, and he actually has capacity to do a bit of clinical work if we need. So he goes around different accommodations. So he's mainly on the North Shore, but he has 1 day in Marrickville once a week. And so it's around Linfield, St. Ives and Gordon if you need any clinical nursing work.
Actually, I was actually just about to ask the next question, which was if they were to ask, because we could have potentially people who are watching from anywhere in the country or listening from anywhere in the country, that we're talking specifically about the northern parts of Sydney in New South Wales. And if they want to reach out to you, Anya, and if they want to learn more about Care2U, if they want to contact you, how do they do that?
So you can go on Care2U website and leave an inquiry form. Or you can, there's an email online, you can send an email to us or give us a call. You can contact me through my mobile, 0408 438 325, or my email address, ivania.choi@Care2U Services.
Now, when you say Care2U Services, just in case you're watching this on YouTube and can't see the logo, or if you're listening on Spotify, Care2U is with the number 2. So CARE, the number 2, and then the letter U, just so that you've got that covered when you go to search for this business.
Thanks, Stu.
No, my pleasure. And Ivania, thank you so much again for coming on today. Really appreciating it.
Thank you.
Thank you.